Medical innovation starts with medical discussion. Talking about the future and what comes next with Project Medtech.
Hello, everybody. I'm Lindsay Deneen, Director of Marketing and Engagement at Project Medtech, and welcome to another episode of the Project Medtech podcast. If we can help you in any way, or you would like to suggest a future guest, you can email us at info@projectmedtech.com. If conversations like this are helpful, that's exactly why we bring people together at our signature events, the Midwest Showcase, the Startup Symposium, and Coming to America. For more on our events that include networking, education, and pitch competitions for startups, check them out at www.projectmedtech.com. We even have sponsorship options if your company is also dedicated to accelerating medical technology to impact patient lives. So reach out today to get involved. The Project Medtech podcast is proudly sponsored by Ward Law. Ward Law Office LLC is a boutique law firm specializing in the practice of patent and trademark law. They are committed to providing inventors, entrepreneurs, and businesses of all types with personal and professional services and are flexible to meet your unique needs. It is their goal to both educate on how to secure valuable patent and trademark protection and to provide high-quality services at rates affordable to independent inventors, startups, and small businesses alike. Without further ado, let's dive in.
Okay, Anit, welcome to the podcast.
Thank you so much for having me.
Yeah, absolutely. So, Anit, let's start with an introduction to who you are, your background, and kind of what you currently do in the medtech space.
Yeah, sure. So my name is Anit Behera. I'm a stroke neurologist. I specialize in the care of patients who have suffered either an ischemic or hemorrhagic stroke. Ischemic meaning like a blood clot stroke, or hemorrhagic stroke meaning a brain bleed. I am a clinician. I primarily see patients in the hospital, in the clinic, and I also get to do one of my favorite things, telestroke, where I get to see patients on the video and assess them in the acute setting. I'm originally from the Chicagoland area, born and raised there, and I received my medical training in St. Louis. I did my undergrad, I did my medical degree, I also got my PhD in outcomes research, all in St. Louis. I was in this dual degree program initially for all of these degrees. Afterwards, after finishing my medical degree and my PhD, I came back up to Chicago to complete my neurology residency at the University of Chicago. So I spent some time doing that, about 4 years or so. Then I went down to really, really hot Houston, Texas to get some extra training in stroke. I did my fellowship in stroke and vascular neurology, finished that, and then now I'm a practicing physician in the Chicagoland area, and been doing that for the past year and a half now.
Super
So
cool.
yeah.
So while we're talking about the neuro side of things, are you actually treating these stroke patients, or are okay? So or is your expertise on the post care side of things?
Both, actually, both. Yeah.
Okay.
So I get to see patients actively having a stroke. So I take care of them down in the emergency room. I take care of them while they're admitted to the hospital. I also take care of them when they leave the hospital and they go to rehab. And I also take care of them when they come to my clinic. So I see them at every stage of the way, from the genesis of the stroke till after the stroke.
Yeah, super cool. I want to dive more into this, but we have to talk about. Did you go to St. Louis University?
I did. Yeah,
Okay.
I did. I did. Yeah, I
Yeah,
did.
they just had a nice little run in the NCAA tournament. They didn't quite take down I think Michigan, but
Yeah.
they had a really good run though in the tournament and looked pretty solid.
Yeah.
Yeah.
Yeah,
Um,
totally. Yeah, we're the Billikens, so
Yeah.
we're good at. I think when I was there, I think we were in the NCAA. I think we were in March Madness for a bit,
Yeah.
and then they couldn't. I think they lost against KU. So yeah.
Yeah. Yeah. It's so funny. If I go to my list of searches from this
Yeah.
weekend on Gemini, one of them was, what is the mascot of St. Louis University? um,
Yep. It's a Billiken. Yeah.
yeah. Yeah. It's super, it was super cool. They looked cool in the uniform. I just didn't know what it was. Yeah. Um,
Yeah.
so awesome. So Anit, tell me about, you're going to be a physician. What takes you down the route of the neuro side of things? Like what brings you into stroke patients? And then also what possesses you to do an MD PhD? Like if an MD wasn't long or hard enough, you said, let me throw a PhD in here. So walk me through some of those core decisions and how you navigated that.
Sure, sure. So I'll start with the second question because that sort of brought about the genesis for why I went into neurology and why I decided to take care of patients who have suffered a stroke. So I've always known that I wanted to go into medicine. I think this was something that I had a deep passion for. I always was taking care of people when I was young. It was something that I had a like a deep rooted interest, and my parents also sort of made that blossom when I was a young kid. So taking care of people who have been sick has been something that I have had. It's something that I've really been passionate about, and part of the reason is that I appreciate the fact that we really don't know a whole lot of things in medicine. I mean, we go through all this training in medical school and residency and fellowship, and at the end of the day, I mean, the cases that we see still amaze me. I mean, there's so much still that we need to learn, and that's where I sort of did the route of going towards the PhD. I love the fact that I could um, research some of these things. I could partake in that and really make an impact in trying to search new novel treatments or trying to bring existing treatments to light for our patients. So that's where I sort of fell in love with research during my college years, where I was getting ready to go into medical school, and then I started doing a lot of research. During my undergrad years, and then I realized that I just needed to do this route of MD PhD. And really, the benefit of it was that I got to do both degrees. It was a very long 7 years, but it finished finally. And I got to get my medical training, and I also got to do my PhD in outcomes research, which is a specialty where we do primarily a lot of clinical research, a lot of like biomedical research, biostatistics as well. So it was a good learning experience, and not only that, but it also trained me to help become a better physician overall as well. So finished that, and then finished my med school, and then came up and did my neurology residency. So I think the reason of why I became I became a neurologist and a stroke neurologist, is because it stems personally for me. I mean, I had a family member who suffered a stroke, and it's always made me really inquisitive in trying to figure out, okay, what can I really do to take care of these patients? And so I really love the fact that there is a good outcome that does occur in these patients, and I get to see that in clinic every once in a while. I hear the voices that the patients come and tell me that, hey, doctor, you saved my life, and I hear that, and it just melts me. I cannot I cannot express it in words to tell you that how much it feels good to know that after taking care of patients, you get to see them in the clinic, it's just amazing to see how much they have recovered. So that warms me so much, and it really motivates me to keep doing what I'm doing.
Yeah, that's awesome. I want to dive further into the stroke piece as well. But before we get away from the MD PhD piece, obviously you being an MD helps you have a very good understanding of the clinical workflow of a hospital, how innovation fits into that. You're obviously very interested in medical innovation. We'll dive into some of that a little bit later on as well. But how did your PhD help you understand the medical, the development side of medical innovation, the clinical outcomes piece of this? Because there's the clinical workflow and saving a patient's life, and then there's all these other things, economic value. Do you really have enough data to effectively say, yes, you should adopt my new technology? So how did that education help your line of thinking or influence it?
Yeah, no, absolutely. Yeah. So during my PhD years, I actually was a consultant for physicians. So I would interact with clinicians. I also interacted with prominent healthcare management groups as well. And we would be consultants for them in the sense that if there was any idea that they would like to look into, whether it's a clinical idea or whether it's something in the tech space as well. They would hire us. We would sit down with them. We would come up with a proposal. We would figure out where is the need for this. And then if there was a research sort of question that we needed to answer and data that we could acquire, then we would do that. We would acquire that data. We would analyze that data. I have a statistical background, and so I would analyze that data, and then I would report that data, and we would give these reports to our clients saying that, okay, these interventions proved to be beneficial for our patients. And so it ranged from quality improvement projects for single physicians to I worked with the company when I was in St. Louis. I worked with a prominent business company where we looked at all of these insurance data, claims data, and to sort of see how the impact of a certain educational intervention was making an impact in the emergency room. So, and then even with the tech space for devices and such, we were involved with clinical trials, and so we would be the statistical component, the data acquisition component in these clinical trials. And so I would say it's made a tremendous impact in my medical career because I got to see that other side where folks who were trying to build new things for the healthcare space. I was involved with sort of the understanding and to see if the validity of it was beneficial for our patients. And I'll give you a good example. Like for example, I worked with one of the healthcare systems in St. Louis. We developed a tool for assessing dysphagia and aspiration risk in patients who had suffered a stroke. And we found this really nice. We created this tool and noticed that it was beneficial for our patients. It was very nice and quick. It was able to assess their swallow function pretty adequately, and it was just as good as the gold standard. So simple things like that, but also like complex things like devices too, is something that we were involved with as well. So I think it has made a tremendous impact in my career, and I'm truly very appreciative for that.
Yeah. So on the stroke side, there's so much innovation in stroke, but it's such a complex issue, right? I mean, it's identifying that a stroke is taking place. It's getting that individual as quickly as they can to some type of intervention. It's the catheter to get the clot out or stop the brain bleed, right? There's multiple components there. Then it's the post care, right? And how important that is in identifying those types of things. Where do you think is the biggest area for improvement when it comes to stroke care? And I ask that because I do think it is unique in terms of its complexities. And I think that one of the things that probably most uh, uh, physicians like yourself knew, but COVID highlighted for people who maybe aren't as familiar, is the importance of being able to detect that the disease state is happening. Stroke, we always knew that was an issue, right? The longer it goes without being treated, the worse the symptoms are going to be post stroke. And COVID was great because it was like, well, who has COVID, who has the flu, who has this, who has that. You have the importance of diagnostics. And so I'm curious for your side, is it on that diagnostic side, is it on the post acute care side, or is it the actual intervention itself?
Yeah, yeah. Actually, I this is a very actually loaded question. And I will tell you what are my thoughts on this. So I'll let me break it down into four segments in stroke care. So there are, if I were to break down care of a patient who suffered a stroke, there are four different segments that I would look into. The first one being prevention, so secondary stroke prevention or stroke prevention in general. The second thing is that acute aspect of things. So those patients who are suffering a stroke right there and then, and what we can do right there and then. Those patients who have already suffered a stroke, but they're not really eligible for any of these acute treatments. So, what can we do during that time period? So, sort of like the post acute, subacute phase, you could say. And then the final aspect is rehabilitation. And I will say this that um, I think there is a lot of work that can be done in all four segments, but I'm a little bit biased, and I will say that my preference or my opinion is that I think there is a lot of nice research that's coming out in the rehabilitation phase. I think there's a lot of new devices that are coming in for patients who have suffered a stroke and how we can help with recovery from that. So I think there's a lot of good research and a lot of upcoming research that we could implement in the rehabilitation phase. Along with, I think there's some good theories and research that also is coming in the prevention phase as well. So I think those two, in my opinion, are the final frontier. I think we're doing a lot of amazing work in the acute phase. Like we talked, like you just mentioned, we've expanded our use of the thrombolytic of a medicine called tenecteplase recently to up to 24 hours for certain types of patients. We are going in and using a catheter to physically remove the clot now, and that was something that we didn't have since 2015. So a fairly new thing that's emerged in our stroke market as well. Um,
Yeah.
we're doing more invasive testing now for determining what is causing our stroke. So we're actually looking into more rare causes of stroke, doing genetic testing and such. So there's a lot of things that I think I can go on what we're doing here, like what we have improved in that acute and that post-acute phase. But in my personal opinion, I think there is a amazing world out there for post-stroke rehabilitation. I think there is a big market that is coming and emerging there, and I think that's where a lot of new cool gadgets and devices are going to come up now.
Yeah, super interesting. The rehab piece, you're going to be pandering to my wife. She's a physical therapist, and she works in skilled nursing facilities now. But she used to spend a lot of time in acute care, and post stroke
Yeah.
patients. And so
Yeah.
she'll love to hear that. So tell me a little bit about some of the work you're doing in the innovation space. I mean, I was looking up, before our call when we met previously. I know you do some work as a consultant and advisor for some stroke companies, and so tell
Yeah.
me about what interested you in that, how you got into that as a physician, and why you
Yeah.
continue to do it.
Yeah, of course. Yeah. So I do some consulting work on the side, more or less as a hobby, you could say. When I'm not in the hospital, or I'm not in clinic or such, or I'm not teaching or doing research, I do a bit of consulting work. And the reason why I do this is that I feel like spreading knowledge apart from interacting with patients or education wise, spreading knowledge is, I think, something that we should be very, very open to. I know a lot of folks have come up to me and asked me, like, what are your thoughts about this? And what are your thoughts about certain devices in this realm? And I think physicians have a very important role in that space, because we see these patients every day, and we have the scientific background, a bit of that scientific background. And getting a clinician's input, I think, is imperative, because um, there are amazing devices out there that are coming out, but also we got to really make sure that it's safe for our patients too. So coming up with this awesome idea to see if they could be helpful is great and all, but to make sure that it's beneficial, there is a safety aspect to it as well. And we just have to follow the protocol to make sure that we can bring it into the market. So some of the organizations that I work with, um, one of which is an AI company where we look at imaging. We look at the analysis of acute imaging, so from CAT scans or blood vessel imaging, and looking at how blood flows within the brain, and then sort of diagnosing how much an area of the brain has already died off or is actively dying off. And based upon that, we are making clinical decisions to go forward to treat or not to treat. So before, we would just look at the scans and then come up with an idea that, okay, it's probably okay to treat. But given all of this information that we're gathering from a lot of these softwares, it's very helpful for um, giving treatment, but also the most important thing is it safe to give the treatment? So that's one company that I'm consulting for, in the sense that we are actively trying to tinker with their imaging technology, and sort of how their software is helping us in treating patients who have had an acute stroke. Um, the other thing is that just sort of a system of care basis. So um, the key thing in stroke is this phrase that we know of as time is brain. And so we should be fast in giving an intervention. And a lot of these companies are trying to make that very accessible. So communication with EMS, with emergency medical services, communication with other doctors, communication with the nurses, the therapists, everything. All of that is imperative. So that has been very beneficial with a lot of these emerging tech, where we can communicate things super fast and then really come up with a plan right there and then. So I can give you an example where I had a patient who had a blood vessel clot in the brain. We were communicating on the app that here's what's going on, here are the deficits, here's what we find, and almost 5-10 minutes later, we had a good plan. We sent the patient to surgery. Their deficits improved from something super major to something just very minor. And so communication has been a very key aspect in the tech world. So I think that is something that we've been trying to help I've been trying to help as a consultant. And then finally, another company that I'm a consultant for is actually a rehab. It's not a company; it's actually a nonprofit organization. It's a rehab focused type group, and I think that the next best thing for a lot of the emerging tech is education for patients. So one of the things that I was taught when I was an undergrad and graduate student was that health literacy is one of the most toughest things here in the United States. So education of what is a stroke? what can we do to help prevent stroke? What can we do to help treat the stroke? I think all of that is very beneficial because that is where prevention can come into play. If we treat their underlying medical conditions, whether it's high blood pressure, high cholesterol, diabetes, that can also help prevent any future strokes as well. So I work with this company to help with dissemination of information to the public, and we try to help these patients from a stroke perspective, from a rehab perspective, and seeing if we could spread that knowledge to everyone. So I like to say that that is, I think, where a lot of the emerging tech is going and what it is most beneficial for. And I hope to continue to do so.
Yeah. So when you give feedback to these companies who are innovating in the space, right? Obviously, people are trying to figure out, hey, where can my product fit in? Would you use it? Is it better than what's currently already out there? What makes you excited? How do you balance your feedback with maybe you, Anit, are really your barrier to use a new product might be lower. Hey, I'll give it a try, or I'll give you really good feedback. Yeah, I could see myself using this. How do you balance that versus you might be more of an early adopter, and there's
Yeah.
others that you work with that are laggers. Hey, this isn't broke. I don't want to fix it. It's good enough. And so you kind of got to give that feedback of like, yeah, I would use this tomorrow, but I think that in order for, my colleague to use it, you're going to have to provide this, this, and this to get them over the hump. And I ask this because I think that, generally we tell investors, like when we talk to startups about investors, we let them know that the barrier to entry for an investor to be interested in you is different depending from investor to investor, class to class. It depends. And I'm curious, like I think that that's a place where startups struggle, is getting the laggers to give thought on a new product because they're generally not willing to talk about it. And so I'm curious on how you treat that as a physician giving feedback.
Yeah. The biggest thing is research, data. So for us physicians who implement these products for our patients, the biggest thing is research. And the even I look at this very closely before I utilize a product or an innovation or something tech related. I always read up on the literature. So um, I'd like to know if there is any benefit that this intervention or this tech has made in that space, because um, data is, for me as a researcher, is absolute. It tells me whether or not if this intervention is helpful or not. So that's the reason why whenever an intervention does come up or an emerging tech does come up, it's imperative that we have data to back it up, because you can have the greatest idea in the world, but if you don't have any data for it, it's not going to go anywhere. So for me, data and research are the biggest thing. And I'll add one more thing. I think the other thing is safety as well. Um, we are advocates for our patients. Okay, all of us are trying to help our patients get better. And as a clinician, my first goal is to do no harm. So if there is a nice thing that comes out in the market where it could potentially benefit my patients, I'm also going to look at what are the side effects, what are the adverse effects that can cause that can happen with this new innovation. So and a lot of us sort of get a little bit wary and start thinking, oh my, this may not be that beneficial, and it may lead to more problems than solutions. And so that's where a lot of us get a little bit hesitant in adopting these things. And so safety data and research, these are the primary things that we look for in this space. And that I think is imperative to look for before we do adopt it. I look at it before I talk about it with my patients. I want to know every single nook and cranny about an innovation before I implement it, because at the end of the day, I want to make sure that it will not hurt my patients, and I also want to know if it's going to benefit my patients. And I think a lot of physicians are in that same route, and when they hear one or two bad things, and then they're like, okay, we're out of here. But I'm a little bit more open because of the fact that I do believe that we have to be open for other treatments out there. We just can't be stuck in the old ways. And I think that mindset comes from the fact that I'm a researcher too. I did a lot of consulting work when I was a graduate student, and I've seen that there is benefit when we change our practice guidelines and we find new things to help treat our patients. So we're scientists too, right? So we have to find new things to help take care of patients. And if you're not open to that, then then you're going to get outdated, and you're also not going to be giving the best care for your patients as well. So I think it's important that you should have an open mind, but also be aware that if these new innovations can be helpful and beneficial, along with the most important thing, if it's safe for our patients.
Yeah, that's such great insight for innovators listening in. How much do key opinion leaders matter? Not from the sense of like a startup having a key opinion leader, and so that's going to help them with investment dollars or getting into a hospital, but how much just in terms of market adoption does that matter? Do a lot of physicians go to their major conferences and say, "Whoa, that person's doing this. I want to know more about that," or this is a highly published physician who's speaking about this. I should tune into that. Is that a real thing amongst physicians?
Absolutely, yeah. So we're a tight knit group, especially in the realm of stroke neurology. We know each other very, very well because there's just a couple of us who are in this subspecialty. So we know each other by name. We hang out. We know their families. They know our families, and so because of the fact that not only are they good friends of mine, but they're also good mentors of mine. They're colleagues of mine, and I enjoy hanging out with them uh, in a non-professional sense, but also in a professional sense when I need help with the case. And in that situation is when we usually talk about new innovations or ideas that come up. So. And a lot of that can also be disseminated through, like you mentioned, conferences, through talks from prominent leaders, from prominent experts, and just interaction with them. So I am a big fan of going to conferences. I go to conferences whenever I can and interact with the experts in the field of whatever aspect of stroke they're in. So, and I always ask questions. I always look into what work they're going into or they're doing, and then I do my own research as well. So I think conferences, and then finally also talking with them when they come in as invited lecturers. I think those are also beneficial as well. So I think we talk in a professional sense. We also talk in at home over dinner parties and such like that. So all of that is critical in our work. And I'll tell you this: we doctors were it sounds really bad, but we're always working. That's the thing. When we're not in the hospital, we're at home and they're looking at patients' charts and such. So, and people are looking into we're looking into taking care of patients at home as well. So, and we talk to our colleagues at home as well. So we're always working, and so I think that is why interaction with our colleagues or other physicians have been just constant with us. So
Yeah.
that's why we're always communicating with them.
Yeah. So generally towards the end, I'll sometimes ask folks like, hey, do you recommend a business book that has been influential? And if you want to give an answer to that, like a book that you think is really beneficial to our audience base, then give the name of that. But I actually have two other questions for you that I think are interesting, just based on where our conversation's gone. The first one is going to
Yeah,
be, so if you want to answer the book one, you can answer the book one. The second one, I guess, is going to be, if there was one piece of advice, you given a ton, but if there's one piece of advice for an innovator out there that's trying to get the attention of a clinician, summarize that. What is that one piece of advice? And then the third question, and I'll remind you of these if we need to go back to them. The third question is, if there is a innovator not in the US market, they're overseas, they're looking to come to the US market, what's your best piece of, what's your like, hey, if you're coming to the US market, you need to understand this about our healthcare system because it's complex. It's much different than a lot of other countries. And so those are my three. Let me know if you need to repeat them.
sure.
Yeah.
Okay, so I'll answer the first question, which is that one piece of advice
Yep.
for someone trying to get into the market. Don't be discouraged. Okay, so ideas are great. So when you come up with an idea, you should always write it out on paper. Come up with that plan of how you want to implement that idea, and then come up with a nice outline of, all right, these are my goals for coming up with the steps for trying to bring this idea into the market. A lot of people are going to be out there and they're going to give criticism, and they're going to say, "Oh, this is not going to work, and you should just throw it away and just forget about it." But I say no. If you are very, very passionate about your idea, go ahead and move forward. Do what you can to try to bring that idea into the market, and then see if it eventually works out. But if you don't expand upon it, you don't try it, then you won't never know if it's going to be helpful or not. So always don't be discouraged, and if you're very, very passionate about it, try to put it down on paper and move forward in trying to bring it into the space. The one thing I'll add to that, on top of that, is try to have an expert come in to give comments about your idea. So we call them subject matter experts. So try to get an expert on your idea and see if they can give you little tips on, oh, maybe we should consider doing this, or this sounds great, I think we should move forward. So be sure you get an expert involved. And I think in the health tech space, I think it's important to really have a doctor. A doctor can really provide that expertise in that realm. So to really expand upon the idea, try to get an expert to comment on that idea and tinker it a little bit, and then move forward. So I think that answers the first question.
Yep.
You'll have to remember me the second and third one.
The second one would be for international company looking to come to the US. What is your best piece of advice for understanding the US healthcare system?
Yeah. So for that one, the U.S. healthcare system is very, very, very complex. It is changing, in my opinion, every hour, every minute. But I'm not trying to discourage them to come here. What I'm trying to tell you is that it's a very, very loaded system, and to really understand it is not even feasible. Like even I, as a physician, probably don't understand every single component of our healthcare system, and that's okay, because at the end of the day, your goal as an expert is to be an expert in the realm of whatever you're trying to bring forth into the market. So what I'm trying to say is that if you're an international company trying to come into the United States, you should have obviously you should try to understand a little bit of how people get treated here, in the sense that how does a patient come to our clinic, or how does a patient get admitted to our hospital and such, sort of the day-to-day, I wouldn't say day-to-day, but like the general workflow. But to know every single aspect of our healthcare system is just out of the question. So getting a feel of that would be, I think, very, very important. But also, I think it's okay to not know everything and to still come into the market and really express your idea that you want to bring. And so I think the biggest thing to be aware of is that if you have done your research and whatever device or tech that you would like to talk about, really come in and just be ready to talk about it to a bunch of people. I think that is the best thing for you. So, and the best way to really sell it is to go to these conferences. Go to conferences, go to meetings, and really talk to these physicians and other healthcare providers. So
Awesome.
I think that's the best. Yeah, I think that's the best way to. I think that's one piece of advice that I would say
Yeah.
to those folks.
Yeah. Yeah.
It
And
really,
I love it. And then the last one is a book recommendation. I originally said
yeah.
like a business book, nonfiction, but honestly, if you want to recommend a fiction book, that's cool too.
Yeah, so it's been a while since I've actually read a book other than a medical textbook, to be honest. So let me think. That's a very good book. I mean, that's a very good question.
Yeah.
So I think the last book that I've been reading actually was let's think. I would say it was oh, the name of it is just escaping my mind. It's a book on multiple personality disorder that I'm
Oh,
reading, and it's a weird book.
yeah.
I can't remember the name of it, but the reason why I'm highlighting it is because it's a patient story. Okay.
Okay.
And the reason why I really liked this book was because of the fact that it gave a patient's perspective on her diagnosis and what were her her issues dealing with multiple personality disorder. So I really liked that book, and I think that is something that if there's any book, if I were to have to say, if I recommend any book that is involved with getting a patient's feel of a condition like ischemic stroke per se, I think that would be a very good book to read.
Hmm. Yeah, that's interesting you bring that up because we either had to watch a documentary or read a book about Sybil when I was in high school. It was like I think
I
the
think that's it. Yeah, that's the
yeah
thing. Yeah, civil. That's
yeah,
it.
and
Yeah.
and she might be the first. I think she was like the first story told about multiple personalities. And I forget all of it, but it's a if you don't know about it about Sybil, it's a good topic to read about. And there's probably multiple at this point, multiple documentaries, multiple books about it, but awesome. Well, Anit, I really appreciate you joining. We'll have a link to your LinkedIn here in the show notes, so if people want to connect with you, they can. This is a video and audio podcast. For those who are just listening in, Anit's doing this at the hospital. He's in his scrubs right now, and so couldn't be in a better background for what we're talking about on Project Medtech today. So, Anit, really appreciate you joining, and hang on for 1 minute. We'll chat offline.
Thank you so much, Duane. Appreciate it.
Yep.
Hi, I'm Freddie Coffey, Director of Marketing at Jumpstart. The Project MedTech podcast is proudly sponsored by Jumpstart Inc. Jumpstart's Trailblazer Accelerator helps Ohio's most innovative early-stage health tech startups fast-track their growth with tailored advising from serial entrepreneurs, non-dilutive funding to fuel their journey, and unrivaled access to a network of experts, resources, and investment opportunities. Whether it's improving patient outcomes, advancing digital health, or reimagining care delivery, Jumpstart provides the high-impact services and critical resources to bring big ideas to life. Learn more at jumpstartinc.org/startups.
Thank you for listening. At our core, we at Project Medtech are networkers, educators, and consultants. We meet you where you are to bring value and to create impact. We care deeply about helping medtech companies succeed right from the start, through to exit, by providing consulting and fractional services, hosting impactful industry events, and of course, sharing incredible guest insights like the ones you heard today through our podcast. Please reach out at any time if we can be of assistance. Check out our website at www.projectmedtech.com or email us at info@projectmedtech.com.